So my whole thing is, we were having this conversation in the hallway about access and accessibility. And one of the things that I love about your centers is that there's a lot of them, right? So pretty much wherever anyone is, they could stop in and they could be seen. And I think that that's super important, especially when you take a look at healthcare access and how that affects communities of color. So can you just tell us a little bit about what you do and why that is important for people to be able to make sure that they can have access?
So access to me, it's multiple things. It's locations, should be very convenient locations. We'll have almost 40 in New York City alone. And then the first floors, they're in the corners, 1-2 blocks from metro area, very easy to get. We have 170 locations nationwide in almost 30 states. It's also time. We work 7 days a week in many locations, extended hours. So people that work can come before work, after work. Last but not last, affordability. We take all the insurances. We try to make sure that everyone can afford the care. And if people don't have insurances, we work with them to get the care that they can afford. So for the access, it's not just locations. It's locations, time, make sure that people can afford. And if we have those goals, we're able to achieve it. That's what USA Clinic's about. Bringing cure. So we focus on few very common conditions that's super common and affect tens of millions of people. And we focus on treatment that one and done. You come, we get it fixed, and you go with your life. And it's all done in the office, outpatient, and number of conditions that we can treat increases, and number of patients that we can help with innovative procedures goes up. So I think that's the future. No hospitals and no suffering, but very short outpatient, easy procedures that can return great quality of life.
That's great, because I think that's a huge misconception, right? Especially when it comes to fibroid health, right? We women, we sit around, we have cramps, we feel pain, we just kind of pretend that it's not there, and then it progresses into this huge problem later on, right? Which can lead to other negative things. So when you say that it's affordable and you say that there's a solution, I mean, we were talking about one of the procedures that you do where you don't even have to necessarily, it's not invasive, right? Where you have to be cut open. It's pretty...
It's a needle hole. So fibroid, I think, is incredible. Like, I was shocked. I'm a heart surgeon. I was trained at Brigham and Women's Hospital in Harvard. I was faculty at the University of Chicago. I spent a lot of time on the magic of heart surgery, heart disease, vascular disease. And eventually we started treat vascular disease in a cath lab. It's under X-ray guidance. And then we had the doctors that the name of the specialty called interventional radiologist. Basically, the radiologists, so they can understand and read all the X-rays, but they do interventions, and they have a license to basically treat any organ in the body through the needle hole. And then I learned about fibroid disease. I could not imagine that 30, 40 million women suffer, and the treatment of choice is hysterectomy.
Wow.
It's removing the organs when, since mid-90s, procedure called Uterine Fibroid Embolization is available, but not very well known. It's available because it's done by this obscure specialty interventional radiologist, but mainstream don't know. And it's through needle hole, either most likely we do it through a needle hole in the wrist, and we bring the catheter that goes through the body towards the arteries that feed, blood vessels that feed these fibroids. We clog them, and then like a stop, watering the plant. And the plant dies and disappears, and the same way, a fibroid dies and disappears. And the procedure takes 20, 30, 40 minutes, 60 minutes, an hour later, patient can go home, covered by insurance, done in the office, and nobody knows. So thank you very much for asking.
Well, I was going to say, why do you think a lot of people don't know about this?
Oh, that's not a nice topic to discuss. They're more exciting, sexier topics to discuss. And people also don't sometimes understand that such a common things that's all and always been around can be not normal. And it's a graduate. It's not like you've been okay for 20 years, suddenly you have a like a heart attack or severe pain like appendix, it's progressive disease. I assume that the menstrual period is not very pleasant.
No.
And it's a big range of what's normal for women, and it's hard to sometimes to kind of in a daily life to understand, oh, this month is worse than before.
Right.
Because it's always pain. How much more pain? But in general, rule of thumb is if it really hurts you, if it affects your life, slow you down, you need to think about this, why not to check?
Right.
And the check is just ultrasound, transvaginal, transabdominal, 5-10 minute study. And it's what I like about fibroid diagnosis. It's very objective. You just see it or not. Mm-hmm. It can be as a grape or can be as an orange. I mean, you see it. It's not like you guessing. Mm-hmm. And if it is, wow, that's the opportunity to fix it.
Right. At what point do you see your patients, right? At what stage is a woman really in a lot of pain? Like, what's the typical turning point, do you think, when you start to see people take action?
It's a great question. You will not believe the answer. It's very late. When people research hysterectomy, like they're sick and tired. I'm done. No more children. I don't want to do kids. I'm 40s, mid-40s, late 40s, 50s, and I just, enough is enough, and they plan for hysterectomy, and they search, there are alternative for hysterectomy. That's how they found UFE. But the right way when people have symptoms, and symptoms like heavy, prolonged bleeding, menstrual period. What is prolonged? 4, 5, 7 days is prolonged. Some women have 2-3 weeks nonstop and bleeding in between the periods. Heavy, that means a lot of blood. Many women take medications for anemia. They have this anemia, almost normal for black women to have anemia. And they take hormones, not very healthy. They take iron, and then they have constipation, not a lot of fun. Some have an iron transfusion. Ooh, not good. Some have a blood transfusion with all the risks of Hep C and other things. I mean, we're talking about very, very, very common thing. Or they just walk around with such a low hemoglobin, and if they have a dental procedure or car accident or something like this, really small thing, they bleed a little bit, but they bleed to death. Or they bleed after delivery. That's sometimes bleeding is a cause of death, maternal, a problem. And if you start normal hemoglobin 15, 16, 14, you can blink half, theoretically speaking, and you still have plenty of hemoglobin, plenty of red blood cells. But if you start with 7, 8, or 4, we had patients that had hemoglobin 4. I don't know how they were walking around. And you have no reserve.
Right.
So that's basically bleeding thing. But also because it's tumor, right? Because it just grows inside, and it shouldn't, it affects other organs. It puts pressure either inside the uterus, a lot of pain, or outside. If it's forward, it's a bladder. If it's backwards or other sides, can be colon. And that's why people say, I have a small bladder. Nothing wrong with the bladder. It's something pressing on the bladder. And also topic, not very sexy, but it is actually sex life.
Right.
It's a big issue. Big issue when women have a pain. And she shouldn't. Shouldn't enjoy it, normal part of life, and women have a pain. There's another killer symptom, literally killer, baby killer symptom, is infertility problem. Fibroids, number one reason for miscarriages, called spontaneous abortion. More offensive word, but miscarriages. 2, 3, 4, and many women learn about fibroids when they lost babies a few times. They're desperate, they come to the doctor, start infertility, and why is that? Fibroids, benign tumors, right, not malignant, kill babies. Because if you can imagine something the size of, I don't know, plum or orange is inside the uterus, it competes with the baby for space and food and blood. So what's really crazy for me, personally as a doctor, is I know the secret. I know that we can fix it, and almost nobody else knows. And that's what was a kind of burning desire inside of our team and our doctors. Like, we had to get it out.
Yeah.
We have to get the word out, and we started Fibroid Fighters organization, non-for-profit, when Cynthia Bailey and many other amazing women join us. And so it's, and thank you for inviting. One thing leads to another.
Yeah, I mean, I think this is such an important conversation. And one of the things we were talking about earlier is, like, the earlier you address it, right, the better your chances are to rectifying the situation, especially when you have such a, super solution to it being quick and easy to fix.
So it's a great point. So you asked me when people call us, and I said, unfortunately, 30 years later, when they basically wasted quality of their lives, and when you get the treatment early or find the resolution early, multiple benefits. First of all, fibroids are smaller, so it's much easier treatment. You don't have to grow them. That's number one. That's a smaller thing. But the biggest benefit, that you have normal life. You can, instead of suffering and in bed and pain, you'll go to college. You'll go to work.
Increase your fertility.
Increase your fertility. Increase your income. It's a physical problem, for sure. It's start. But it's also mental problem, depression, feeling incomplete, incapacitated, limited. It's a social problem. No normal family life, no normal sex life, no normal, social life. You cannot go out. You cannot wear whites. You can always, I've seen our fibroid fighters women. They have this, you watch me, I watch you. Kind of that's a reality. There's they come. Where's the bathroom? So okay, we know where's the bathroom. Now we're comfortable.
So you're building your lifestyle around being that's so top of mind all the time.
Yeah, all your limitation. That's terrible, and that's also economic problem. So if women don't go to work, and many jobs are hourly paid, right? You don't go to work, you don't get paid, so you make less money because you work less. That's terrible. And if women will know that the solution is so easy, covered by insurance, 30, 60-minute treatment, outpatient, that you go home, it's like, wow. Risk and benefit, right? That's how we make a decision in our life. Will it hurt? Will it help? How much will it cost? Is it worth it? So lack of information lead us towards
suffering longer.
So I think talking is super important.
Yeah. And congressionally, it's even coming up as a topic.
So it's been for almost 20 years. Stephanie John's Fibroid Research and Education Act. They, again, worked in 2023. They made a nice progress in the U.S. Senate and Congress. There was a bill that actually passed, similar bill in Florida, about research and education, where every woman is eligible for free ultrasound covered by insurance for fibroids. And if fibroids is found, it will be a disease that need to have attention and recorded in a state database. So it's very, very important, because they know how much it affects women's life and how much opportunity it will unlock for a woman, young or older woman, if this thing will just go away.
Yeah. So what do you see the future of fibroids look like? I mean, you have such an innovation in terms of the treatments that you offer, but where do you see, I guess, the space at large in terms of women's health?
I think the fibroids should be gone, like a crooked teeth is gone in America, right? Like everyone in the middle school can get their teeth straightened, and just state pays for this. It's God-given right almost, because That's how we believe. It provides better opportunity. So the same way, if women start suffering from fibroid disease, she needs to be confident that it will never, ever ruin or limit her life. When the moment is right, better early, they will ask for, if they're candidates for minimal invasive treatment and fertility-friendly treatment. No surgery, no removal of organs, no cuts, to fix the problem that can lead to normal fertility and ceasing the symptoms in early age, and feel confident that she will not suffer like mom or grandma or aunt or sister. So that's the sense of control over your future. And fibroid should be gone, eliminated as a class of suffering.
Yeah.
I think that would be major. Can imagine, women of color or white women, no fibroid suffering, no hysterectomy, no.
That's a huge solve for society.
Absolutely.
Yeah.
Happy wife, happy life, right?
Yeah,
happy
that's
woman.
the motto.
I know
the
that.
motto, yeah. So I kind of want to talk a little bit about the experience of going to the OBGYN, because we were having this conversation a little bit earlier. Like you go to the OBGYN, you're having issues, you're having problems. You might not be able to articulate it, like exactly what you're experiencing. What would you say is a misdiagnosis rate of someone who might go to the OBGYN and their symptoms might be overlooked, or it might be foreseen as something else other than fibroids?
It's a great question. It's such a common thing. And some doctors, not all of them, but some doctors might have a kind of sense like, 20, 25, 30 years old, too young to do big surgery. So what's the point to diagnose early? And although diagnosis is very, very easy, ultrasound, or a woman just delay going to the doctor and asking or not mentioning that they have their periods worse and worse and they have other problems. So it just not uncovered. And if it's uncovered, there's no actions. There's a tendency to delay, and many conversation goes like this, Mary, you have a fibroid disease, but, let's try. Maybe you'll get pregnant, and when you're done with the babies, we'll
check it out.
We'll do hysterectomy, eviction, right? So, unfortunately. But the real thing, and one of the reasons, it's in general in the medicine, the specialty were invented to do surgery on certain parts of the body, because general surgeon cannot treat everyone for every reason.
Right.
There was specialization. And gynecology is basically surgeon specialist for, for the woman's organ. But this new trend in the last 20 years, 30 years in medicine, like I'm a heart surgeon, right? So my specialty was significantly affected by interventional cardiologists, when instead of open heart surgery and even smaller surgery, we just do a tiny needle hole and do stents and open arteries and save patients from heart attack without any big surgeries. Even change valves, put the valves without surgery. So the same thing for most surgeries can be changed, replaced with innovative treatment through the needle hole. And it's done by interventional radiology. So example for gynecology, for women's health, is uterine fibroid embolization. There are examples also for urology. So I don't want gynecologists to feel like, oh my God, they were just the only one changed by the progress. Heart surgery, my specialty was very much changed. Urology too. Benign prostate hypertrophy, like when men need to wake up at night and go to bathroom, many women know. When the husband or whatever partners go there, apparently instead of big surgery, can be also shrinked by prostate artery embolization. So more and more and more treatments coming even for arthritis, for knees, we can do such a procedures. So I think women just need to know that sometimes it's not old-fashioned gynecologists.
Right. It's a little more complex than that.
It's a little more complex. There are other specialists that they can help. I'm sure if they will ask gynecologists, what about UFE, they will get more answers because it's listed in all the websites. But they can just go straight to interventional radiologists like USA Fibroid Centers. And that's what we do. We specialize. So when patients call us, for example, or schedule online, when they come, we do comprehensive examination, including ultrasound, either transabdominal or transvaginal ultrasound. If needed, we do endometrial biopsy to make sure there's nothing wrong, especially for women 40, 45 years old, that no cancer, no bad things. Do pap smear if needed. So we do all
Everything.
of it. If needed, we arrange MRIs. And 2-3 weeks later, after getting approval from the insurance, the private insurance, managed Medicaid, or straight Medicaid, we do the treatments. Everything outpatient, everything is straightforward, so you don't need to go to multiple places.
Right.
And that's the future. You ask, what's the future? You make it one phone call, you come one time, you get all this evaluation, you come a second time for a couple of hours, 1 hour for procedure, hour to recovery, 2-3 days at home, maybe cramps if you have a luxury not to go to work. And that's it. Normal life is back.
What's the youngest patient you've seen?
20s.
Wow.
20s. The worst thing, youngest patient that we have not seen. That was one Instagram. We do this Instagram meetings every week, I think. And there was one girl, and she's crying in the bed, and it's like, oh, I just had a procedure yesterday. My heart sounds like, what did we do wrong? Like we don't have patients suffering like this in a hospital bed. So she's, I think, 26 or so, but she had a hysterectomy yesterday. And today she learned about UFE. She didn't know that uterine fibroid embolization is an option. She's 26.
Wow.
She had all the dreams about family, about children. She did not have, and now she learned. So that's what breaks my heart.
Yeah.
The patients that we don't see, it's irreversible. We have, I look into some database of Medicaid patients, and then many girls, mid-20s, get hysterectomy. They call hysterectomy Mississippi appendectomy. That's how lightly, it's received. And sometimes it's perceived like, oh, no more children, let's remove it.
But sometimes that's not always the case.
That's not always the case. And after that, when you remove it, there's a purpose for the uterus in addition to childbearing, no more orgasm, right? Because no contraction of uterus. And then everything falls down. So, you have a prolapse and difficulties to keep urine and other. It's disaster.
Right.
Why would someone subject yourself to such possibility of suffering if you would know? So the main reason people subject themselves to such suffering because they just don't know. That's why what we do, what you invited me to speak about, is what the MEternal podcast is such an important way to educate and give power to women to make the best decision about their life, their body. And listen, people talk, you need to know about your finances, right? Manage your days. You need to manage your diet, what you eat. I'm sure it's important to manage your body.
Of course. Well, I want to thank you for being here today. I mean, I feel so enlightened, and I learned so much about fibroids. I've never had an issue, thank God. But, at the same time, there's so many women that are out there that may be having symptoms who have been putting it off. So I'm hoping that this conversation enlightens them as well and empowers them, right, to pick up the phone, to call you and make an appointment, because it could be life-changing for them.
That's the goal, to change life to the better to every woman who calls us.
Awesome. Well, thank you for being here on MEternal today. Where can people reach out and connect with you and your team?
USAFibroidCenters.com. USAFibroidCenters.com, and they can schedule online. And there will be phone numbers to call as well, but you can Google USA Fibroid Centers, and it will bring you to the right place.
That's great.
Happy to help.
Well, we appreciate having you. Thank you for coming today.
Thank you for inviting again.
Yes.
It was a pleasure.
And you're listening to MEternal on iHeartRadio, and until next time.
Thank you. Oh, we have a free consultations
Oh,
next
right,
week.
yes.
Oh, forgot.
That's okay. You can
People
put it
like
in
free.
there.
Yeah, it's
Yeah.
all covered by insurance, but just in case we have a free
Sure.
consultation.
That's great for people to know. So they can go to your website, find out more information about it, and they can schedule there as well for the
Right
consult?
away.
Awesome. Great. Well,
Thank
we
you.
appreciate you coming, and we welcome you to come back anytime.
Thank you.
All right.